Welcome back to the Regional Health Update. I am Michael Moon, and on the phone with us today is Jeff Mengenhausen, CEO of Montrose Regional Health. Did I get the title right, Jeff?
Yes, sir.
Thank you so much for joining our podcast today. What is new with Montrose Regional Health right now?
Very exciting times. We are growing extremely fast and continuing to add more physicians and services. But really the fun, exciting piece is we broke ground on our ambulatory care center, which is a 4-story, 80,000 square foot building. We broke ground on October 5th, and they've already got pylons into the ground. They've got footings dug and moving right along.
So what is the timeline for the center?
So we're looking at, we broke ground in October, and we're looking at December of next year. I'm going to guess it's probably going to be January, normal construction stuff, but shooting for December of next year.
All right, very exciting. And what services are you expecting to have out there?
Absolutely. So on the whole first floor is dedicated to outpatient imaging, radiology services, so brand new MRI, PET CT for cancer screenings, and then a full women's imaging package for mammogram, DEXA scanning, ultrasound. We've got our cosmetic service line. We've got physical therapy out there. We'll have outpatient lab services. And then second floor will be our Alpine Women's Health Clinic. We'll all be moving out there, OBGYN. And then looking at our musculoskeletal program, we'll be out there. The third floor is all 20,000 square feet. It will be Cedar Point Health, which is the largest primary care provider here in town. And they are true partners of ours, and they're an independent physician group. And then the fourth floor is a ambulatory surgery center, really focused on building our musculoskeletal health program with 4 ORs, 2 procedure rooms, and that will kind of round off the whole building.
Wow, that's a pretty good size move that you got there. I was expecting a little bit smaller. So you got 4 stories, you got every room taken care of. That's awesome. So how will, explain to us, how will ambulatory care center help increase access to care compared to where you're at right now?
So moving the building and moving services off the hospital campus. So you do not have to go through kind of the whole process when you come on the hospital and trying to find where you want to go have an x-ray or a CT or an MRI or a lab, just simple lab draw. You have to kind of maneuver through the entire hospital. So we're taking it out of the hospital and putting it on the busiest intersection in the county, right down in the retail area.
Well, it's funny you said that because I was going to say that.
And so putting it into where people feel comfortable. Everybody that Montrose is becoming a true regional center where people come here from Ridgeway, Telluride, Gunnison, Delta. They go shopping, they have food, and then they go home. And so putting it into an environment where our patients and consumers feel comfortable, and providing that very easy access in and out. And one, it's expanding space for us in the hospital because we are completely out of space. And this is adding so much more needed space for us to grow and add more services to the community. And our goal, the board of Montrose Regional Health's goal is really to provide all of the same services here in Montrose that you can get in Grand Junction.
So this is really improving all the patient experience and giving you a little bit more room to work your magic.
Absolutely.
Very, very cool. So you're saying December of 23, you broke ground here last month. Anything else on the charts for us, Jeff?
Well, yesterday we just partnered with the U.S. Army on their PAYS program, which is Partnership Access to Youth. So we're the only hospital in the whole state of Colorado that is partnered with the Army on this program, and it's for veterans getting out of the Army, guaranteeing them an interview and helping them find a position in the civilian world. And so we just signed that yesterday. Really excited to find different ways to support our veterans, bring more veterans into the workforce, and definitely here in Montrose.
Wow, that sounds great, Jeff. Thank you so very much. And once you get that up and going, and you, like you said, you just took care of that yesterday, is there a place where anybody can call, or is that still a few weeks away?
So it's through the Army National Guard. So any Army National Guard base or contact can participate in that program.
Okay.
One other big thing that we have going on is we have greatly increased our access to our San Juan Cancer Center. And so if any patient, you get the big C word, like you may have cancer, and you call the cancer center and say, oh, hey, you know what, we can't see you for 4 to 6 weeks. Well, that's unacceptable. And so you as a patient would be looking elsewhere. I'll drive to Denver.
Yeah.
Right now, we can get patients in 1 to 3 to 5 days and immediate access to our fantastic cancer center to make sure that our patients feel safe and they know what's going on and they can gain access right to those medical oncologists.
Thank you so much, Jeff. Appreciate your time. That's a lot of great information. Join us next time for another Regional Health Update. I am your host, Michael Moon, and just remember, information provided in this podcast is for informational and educational purposes only and is not meant to diagnose any condition or provide treatment advice. Please work with your healthcare providers to determine appropriate treatment for you. Thanks again. I'll talk to you next time around.